Welcome to episode 218, Unveiling the Complexities and Challenges of Family Caregiving, featuring Diane Bigler, licensed clinical social worker. Make sure to subscribe to be alerted about future episodes. By Clearly Clinical, learn, grow, shine. Hello to our listeners. My name is Beth Irias, and today I am honored to be joined by Diane Bigler again for a conversation today about family caregiving and the reality for caregivers. Diane has previously joined us in another conversation that I encourage you to take a listen to, but she's a licensed clinical social worker. And this particular topic is very near and dear to my heart, as I'm sure that either you've already heard on other episodes or I'm sure will tumble out during this interview. But my thanks to Diane for joining us today on this topic.
Thank you so much, Beth. It's my pleasure to be here, and I'm really looking forward to venturing into all of these different areas of caregiving with you.
Thank you. And for our listeners who are not familiar with your work, why don't you take a moment to tell us about your work and also about how you came to know so much about caregiving specifically?
Absolutely. So I've been in the field now for about 25 years, doing different things within the mental health field. And a lot of my experience, about 13 years of my experience, involved working in home with parents of children, young children under the age of 3 that had a developmental delay or a disability. So I worked with a lot of especially young parents, a lot of mothers in particular, that were in the role and were already identified as being high risk in some other, areas of their life and needed the social work in-home support. And so these were mothers typically that were dealing with parenting a young child that had a disability or a severe developmental delay. And so my role was to provide them with that support and to be able to help them identify some goals, discover their own resilience. And that work always will remain very near and dear to my heart, having been invited into all of those homes and working with all of those different families. And then also I have experience having received care as a cancer survivor, having received care from my husband for a period of about 2 to 3 years. And then the third area that I also have some relevance to this topic is being a witness to the experience of my mother being a caregiver to my father as his dementia and Parkinson's progressed, and seeing her experience and being in the position of being a child of both the person receiving care and then also the caregiver as well. So really, I think, for me as well, Beth, this topic also to me is very important and personal as well for those reasons I mentioned. And I think it's a topic that often doesn't get discussed enough. And my hope today is that you and I will be able to go into some of these deeper areas of caregiving that clinicians and anyone that has also a personal connection with caregiving may find this particular discussion we have really useful for them.
Fantastic. Thank you for joining and thank you for your disclosure. For me, I think many of us that find ourselves in a family caregiver role didn't necessarily intend to. It was because a condition necessitated it. And I think even that, when we're looking at the role of a caregiver in somebody else's life, but also in their own lives and how their relationship to themselves changes. For me, my caregiving journey began many years ago with the severe diagnosis for one of my children that morphed into a different diagnosis. And so now I've been in a caregiver role for almost 5 years. And that has really shifted my perspective on, I think, like everything, like if I'm being honest. But in going through the motions and the challenges that come along with it, even I realized how little support there is for whether it's parents or family members. There's really sometimes a sense of social estrangement because your challenges may be so unique that other people simply can't relate for what you're going through. But so as we begin this interview, knowing that sometimes on the podcast we talk about things that hit close, this is one of them for me. So Diane, why don't we first start by just defining what caregiving is and also talking about how many people in the United States identify as quote unquote caregivers at any given moment? Like, how many people are we talking about here that find themselves in this role?
Sure. Yes. Let's definitely frame, that word that we hear, caregiving. What exactly does that mean? The basic definition of a caregiver is a person who helps an individual with activities of daily living and making sure they are safe, making sure their needs are met, making sure that they are taken care of and loved and regarded as a human being that is worthy of dignity and respect and patience, which can be so very difficult for that caregiver when they're in that role, usually 24/7. Usually, we find that caregivers are designated when somebody is ill, when somebody is perhaps disabled, or they're experiencing the symptoms of aging. We find that those are usually the three categories that we find caregivers are most common. And usually we find that caregiving involves things such as comfort and companionship, um, the domestic assistance with being able to achieve things, whether it is, a child that has a disability or diagnosis and needs that extra support from a caregiver as they're learning. Whether it is personal care, it may involve things such as helping an individual with bathing or grooming or toileting. So, really, if we think about all of the things that we do in our daily lives, imagine that we as independent individuals suddenly needed somebody to help us with the many different things that we do on a daily basis. And so that is really what we typically find that this what we call this informal caregiving, which is usually going to be a loved one that is providing caregiving to another loved one. Also, why is this topic important, Beth? Let's talk a little bit about that, and why did you and I feel that was an important topic to do a podcast on? So we know that the caregiving industry is worth an estimated $300 billion annually. So there's a lot of money in terms of not only the formal caregiving, which is that kind of hired or paid caregiving, but also what caregiving costs individuals, family members, and those loved ones as well. We also know that, as we're going to be touching on today, the strain on the caregiver and the responsibility and sometimes the burden. And sometimes it's an emotional burden. Sometimes it is a physical burden. Sometimes it's a spiritual burden or a financial burden. And so there's many different ways in which caregiving can create this heaviness. And it's almost like this big, heavy backpack that the caregiver is always having to tote around, and they kind of have to shove more and more in their backpack as their caregiving journey continues and perhaps intensifies or complicates. The other thing I want to mention that I think is important, and we can certainly uh, get into this, is the fact that the vast majority of caregivers in our country, in the United States in particular, are women. And so there's definitely this gender leaning into women, often assuming roles of caregiving. We do have men that are in caregiving roles, but we really find that women proportionately make up a good percentage. And it's not probably unusual then that we see that there's higher levels of depression in women, higher levels of heart disease. So is there some connection there by looking at the roles that women typically take on when it comes to caregiving traditionally? And also, I want to mention as well that 1 in 5 Americans are currently in an informal caregiving role. And I'd also like to share, if I could, Beth, just a quote here as we're kind of framing our discussion about caregiving. And this is a quote which I think is really interesting when we look at how caregiving can really kind of affect so many different individuals. And this quote comes from former First Lady Rosalind Carter. And she says this: "There are 4 kinds of people in the world: those that have been caregivers, those who currently are caregivers, those who will be caregivers, and those who will need caregivers." And I think that her quote really kind of gives us some good opening context to helping our audience realize that caregiving uh, will likely impact all of us in some way. If it has not already, as you've shared, Beth, and as I've shared, we've already been impacted by caregiving, but some of our listeners and some of our members of the audience may in the future be impacted by caregiving in one of the ways that is mentioned in that quote.
Thank you. Thank you for framing this. I know in my world as a parent caregiver, certainly seeing a lot of those norms and those stereotypes, one of the interesting things that stood out to me, I kept hearing within parent caregiver circles how common co-occurring illnesses were. So it wasn't just conversations about depression or anxiety, for example, but conversations about, oh, I developed an autoimmune disorder, or I've been struggling with diabetes that I didn't have before, whatever it is. And to me, it was such a beautiful example just of the significant strain. And then I know we'll talk about this today, but also considering kind of the cultural lens around this, that in our culture, given that we tend toward individualism, that means that caregivers don't necessarily have the same support. It's not as common in our culture to see somebody that is rotating through that role with 10 other people because they live nearby. And it's like, okay, Monday is your day, Tuesday is your day, Wednesday is your day. We don't see as much of that. So it explains to me why there's just so much stress on a caregiver and that can manifest medically.
Absolutely. It's that mind-body connection that we've all learned about in graduate school and in our advanced work with the clients that we work with, and understanding how the stress and the strain can really lead to more vulnerabilities for people physically. And the other interesting point, I think, Beth, which we find, and I think is important for clinicians to be aware of, is this context of the compound caregiver, which we're finding more and more of a presence of. And a compound caregiver is somebody that is caring for more than one person. So, for example, let's say that it's a middle-aged person who is caring for an aging parent and also caring for a child that has a developmental delay. So they would be defined as that compound caregiver. And now they have this double responsibility and double experience that they're having with both of these caregiving roles. So that's an interesting part of caregiving that is not often talked about, is that we do have a good number of caregivers who are in that compound caregiving role, and that certainly can make them especially more vulnerable to that physical stress and illness that you were just talking about.
Thank you for pointing that out. In a prior conversation with Gabrielle Giuliano Villani, she talks about kind of that quote unquote sandwich generation and what it's like for someone in that stage to be caring for children while potentially caring for an older family member as well. And one question I have for you before we go further, what separates out caregiving in this realm, informal caregiving, from the caregiving that we think of with a neurotypical, medically stable child, for example? What separates out parent caregiving from caregiving that we're talking about today?
Yes. So parent caregiving is certainly its own unique area of caregiving, as you know, Beth, and looking at differentiating that from what we all imagine as maybe the traditional more caregiving, which is caring for somebody that is ill or caring for somebody that is aging. When we look at parental caregiving, we know, as you mentioned earlier, that there may be a disconnection from other parents that have more typical children and do not have a child that is neurodiverse or is not neurotypical. And so there could be, as you mentioned earlier, this sense of isolation, this sense of a lack of relatedness. If the parents in my neighborhood or in my kids' school or in my kids' world have typically developing children, and their children, their experiences with their children are likely going to be different than what that parent that has that neurodiverse child or that child with developmental or intellectual disabilities, there likely is going to be maybe a lack of relatedness, a lack of connection, and also a lack of ability of where do I connect with other parents that are going through some of the same things that I do. The other thing that I would mention that is likely unique for parents who are caregiving a child that maybe is not neurotypical is oftentimes that parent is still needing to manage a career. which we find is going to be likely more of the case than we would find, for example, an elderly spouse that is caring for their elderly spouse, and both of them are retired, and they don't have that aspect of their life that is present of needing to manage or wanting to manage a career and a professional life. And so that is an area that we find can also add this aspect in of, what if I'm trying to work in my career and in my job, and, some of us can work for ourselves, Beth, but others of us have employers that may not be very understanding if they have an employee who is a parent and needs to go and get their child from school because their child has had a meltdown, and the school is saying, I don't think that Marty is going to be able to finish the day today. Would you mind to come and get him? And so that certainly can lead to that additional stress and anxiety for that parent caregiver if they're trying to manage a job, the financial stress of I need to work in order to be able to take care of my family.
I'm glad you bring up that point because I think that's an important stress for many, if not most, caregivers. Is a financial impact. And I have absolutely said in the last 5 years, I would have been fired many times because, and what I mean by that is if I had been working in your standard 9 to 5, because there so often in the United States, there are some elements of protected leave, but it's often unpaid protected leave. How many people can reasonably do that for an extended period of time or even for a short period of time? So you find people that are leaving the workforce because the math doesn't add up. I mean, that's been one of the conversations that I've had with parents who are caregivers. And this is not just with parent caregivers, but with any kind of caregiver, where it's like the amount of time that I'm spending and the amount of money and effort over here, the job doesn't necessarily offset. It doesn't justify the additional strain. And so then you have a household that had one or more incomes that suddenly slips down to half an income because of the demands of caregiving, and that there isn't necessarily an offset there, particularly if that caregiving isn't available or isn't eligible, for example, for long-term disability. That's where things get really financially sticky. And I appreciate you bringing up that point. It's a whole different ballgame when you're in a system that doesn't provide very much flexibility for caregiving.
Exactly. I think that that's where you really begin to see that hard choices have to be made. And in the situation we're talking about in parental caregiving, there are no easy choices because if you need that income, but you don't have an employer that is flexible or understanding, how are you going to make these decisions? If you are being encouraged to take advantage of respite care, but you have to pay a certain amount for respite care, even for 3 or 4 hours for you to be able to go to the grocery store or go to a doctor's appointment or go get your hair done. That financial burden of having a respite care provider, as you said, if there's not that coverage, insurance coverage or benefits or a community service that can offset that, those are the things that stack up within that person, and they can really begin to feel as a caregiver like they don't have a lot of options and the walls are kind of closing
Yeah.
in.
Yeah. It can take away a lot of flexibility. And going back to your other point too, about a sense of disconnect from others, I had an experience recently where we had a snowstorm, which was a lot of fun for little kids. But the considerations for my child were different in that context than they were for other children in the community that didn't have any kind of disabilities or special needs. And one of our neighbors, when all the kids were sledding, one of our neighbors delightfully came over and said, "Why don't you come talk with all of the other parents and let the kids play?" And I said, "I would love to, and I can't right now." But it was like this perfect example of here I was half a block away from this other group of parents that were standing there with their coffee because I have a different lived experience of what it means to have a child with disabilities who's sledding. It's just a different ballgame.
Yes.
And so it was something
Yes.
as simple as that. And I think it's that appreciation. I'm sure through this conversation, I'll do more self-disclosure, but only through lived experience do we begin to understand the gravity of what we're talking about and how many domains of life are changed for caregivers. Can you talk a little bit more about some of the sociocultural impacts, as we've talked about this financial burden, but also what's happening in different homes across America as we look at caregiving?
Sure. So if we look at things from, let's say, a global perspective first, if we look at, the different cultures and countries and ethnicities and backgrounds that we have represented in our world, we know that caregiving is different in different parts of the world and in different countries. So let's kind of start there by acknowledging that in the United States, we have somewhat of a different viewpoint, and I want to say it's more of this. I guess, for lack of a better word, this progressive viewpoint that we have more privatized caregiving, where we find in a lot of other countries, it's the opposite, where we find that in many other countries and within other cultures and families, that caregiving is still done primarily by the family members. And going back to a term that you used earlier, Beth, collectivism. For example, we know that several studies have found that African American caregivers experience less stress and depression and experience greater rewards from caregiving than their white caregiving counterparts. And one of the theories behind that is based on collectivism and based on looking at, the importance of community, especially within the African American culture. We know that oftentimes there is going to be a network of aunties and cousins and siblings and neighbors and church members, that there is going to be that rotation that we talked about earlier that we typically don't find in the United States with caregivers. We don't see that usual expansive kind of collectivism presentation. So I thought that was a very interesting point when we look at some of the benefits that other cultures have with regard to this collectivism that I think we've kind of gotten away with in the United States as we've more privatized lots of caregiving, especially elder caregiving. We look at, that's become very much more institutionally based in a lot of cases versus being done within the family. And when a family doesn't have that reliance on each other or have that collective support, or they can't really kind of tap in and out and give each other a break, that's where we find that that burden can be very higher and stronger, and more incidents certainly for some of the mental health burden as well. So there's definitely some differences we find. And other examples we find, for example, Asian American caregivers made less use of professional support services than their white caregiver counterparts. And so I think when we look, and especially if we put on our clinician hats, and we look at, for example, if we're working with a client who is Asian and is a caregiver, if we're giving them resources and avenues to get support and they're not seeking those, we may label that person as, well, they haven't followed through, they're not interested in getting help. But can we understand on a deeper level that within some cultures, there is this idea of handling things within the family? And while we as American clinicians may believe that our resources are wonderful and that clients should take advantage of those, I think we also need to have some cultural humility to recognize that even though there may be a caregiver that may need some support and help, that doesn't mean that they're going to feel necessarily comfortable or ready or feel like it's appropriate for them to take advantage of those services. So what do we do instead? Well, what we can do instead is we can help them identify what can be supportive for you in lieu of these professional, formalized support networks. What are some more internal, familial, cultural-based resources that you do find helpful and do find restorative for you in your role?
Thank you. I think that consideration, that cultural element, is really important for clinicians to keep in mind because it has a big relationship, as you said, to what resources somebody may take advantage of. And I feel like one of the complexities in therapy in general, but when we're talking about something like this, is like if you're not exactly as a clinician in the same cultural background as that client is, not to mention like whatever the family's culture is or expectation, we are almost invariably going to take our lens and look at the client through that. And I'm glad you bring up that point of like, no, how does it appear if we are putting, if we're recommending or talking with a client about, hey, maybe it's time to consider additional resources for your parent. But there's this big pushback of like, we don't do that. I have had that happen in my family very recently. I come from a Sicilian Italian background. And the decision for the caregiver to put a family member into an extended care facility was devastating, because it felt like a defiance of our cultural values. And I think that your point is a really good one about appreciating someone may not be taking advantage of resources for the reasons that we may believe, and to try to understand that through a cultural lens. So when thinking about caregiving, as we've already discussed, typically a lot of stress, a lack of support. One of the things that I've experienced in my own caregiver support groups, and not ones that I facilitated, ones that I attended, just to clarify. One of the things that I heard a lot from folks in those groups was, I don't have time for self-care. Like, that's really cute. Thank you for that recommendation. And that even that recommendation can come from a place of care while also being from a place of privilege and ignorance. When a caregiver can't do the things that we would normally reach for, it's like, oh, take a break and go on a walk. And it's like, no, if you have a person who cannot be left alone for whatever reason, that is not reasonable. So can you talk about like, where do we go clinically in offering resources? And then I'd like to talk too about like, how do you emotionally as a clinician work with caregivers, because their needs are perhaps different?
Yes, great questions. Let's talk about how, as you said, how can clinicians support individuals that are in that caregiving role? And I want to share a few great external resources for clinicians that will be helpful in beginning the discussion with a caregiver, and that will lead us into then discussing some of those other ways, other than the bubble baths and the, kind of get your nails done, which, as you said, not always practical for many caregivers. There are some great resources for clinicians to open up, as I call, kind of open the door to a conversation with a caregiver. One of them is the caregiver self-assessment, and this is available from the American Medical Association. So if you Google just caregiver self-assessment, American Medical Association, that will come up. And I just want to read a few of the questions because it's important for a clinician to know what areas of caregiving is somebody possibly really struggling with, because I kind of call it like the caregiver imprint. Like, each caregiver has their own, almost, if you imagine like your fingerprints, as we've heard, no two people have the same fingerprints. All of our fingerprints are unique, and the same principle applies to caregiving. All in each caregiving experience is unique, and so each caregiver creates their own imprint of their strengths, their vulnerabilities, their most difficult areas of caregiving for them. And so this assessment is a great way to kind of identify that caregiver's unique imprint. And it asks questions such as, for example, during the past week, have you had trouble making decisions? Do you feel that you can't leave your relative alone? Do you feel lonely? Have you had back pain? Have you been satisfied with the support that your family has given you? Have you been edgy or irritable? Has your sleep been disturbed? Do you feel strained between work and family responsibilities? So there are 18 questions on the caregiver self-assessment, and I just read a few of them, but as you can tell by the questions that I read, they allow the clinician or the caregiver themselves to elicit whether they're physical indications, spiritual, psychological, and it's a great starting point for both the caregiver and for the clinician to say, what is your caregiver experience? And what are the areas that you feel like you have somewhat of a good handle on, and what are the areas that you really feel like are slipping away or are really the ones that you find consume the most of your energy. So I recommend that as a great starting point. And then I'm going to share another great tool as well that is a wonderful resource for both caregivers and clinicians. Before I do that, I do want to talk about one really important aspect of caregiving that I don't think gets enough attention for caregivers, and that is self compassion. Because you think about the caregiver that brings in their heart, they bring in their physical self, they bring in sacrifice. The caregiver brings in the spirit of compassion. They bring in energy, dedication, and love. And we know that a lot of caregiving is encompassed by compassion, that the caregiver is giving of time and patience and love. But how does the caregiver give themselves compassion? And there's a great website. I love, love, love this website, selfcompassion.org. Dr. Kristen Neff has done a wonderful job. It's been her mission for the last about 15 or 20 years to do research on self compassion. And she's brought some wonderful resources to her website. If you want to go to her website, she has some worksheets, but she also has some free audio downloads where you can listen to her walking you through a self compassion exercise. And if you have 5 minutes as a caregiver, if you have just a few minutes of stillness and you're wondering, how can I replenish myself and recenter myself? Great opportunity to put on your headphones, find a quiet space, maybe turn the lights off, close your eyes, get a cold drink, and just allow yourself to walk through one of her exercises. So I just want to kind of share one of her exercises, a brief exercise to give people an idea of this concept of resourcing. So we use this term resourcing, which can be a great way to reframe this concept, Beth, of, self-care, which we think of, getting a massage and getting your nails done and all of those kind of higher order things that the caregiver may or may not have time for. But I'd like to bring in this term of resourcing. So introducing this term of how can a caregiver take a few minutes just to resource for themselves. And so let's look at this self-compassion exercise. Feel free to just take a few deep breaths. If you'd like to close your eyes. But I would like you to think as a caregiver of a situation in your life that is difficult, that is causing you stress. Maybe there's a particular aspect of your caregiving that really takes a lot out of you, really is one of the highest demand areas of your caregiving. Call this situation to mind and see if you can actually feel the stress and emotional discomfort in your body. Where do you feel that in your body? Really identify. Is it in your neck? Is it in your stomach? Is it in your legs? Is it in your hands? Is it in your heart? And then I would like you to say to yourself, this is a moment of suffering. This hurts. Ooh, I feel this. I feel it in my chest. I feel it in my soul, or I feel it in my shoulders. This is stress. I'd also like you to say to yourself, suffering is a part of life. It can be painful, and it can seem like it never ends. But acknowledging that suffering is a part of life is part of our own self-compassion. Other people also feel what I am feeling. There are other people right now that are also feeling what I feel, that are also suffering, that are also straining under the stress of caregiving. I'm not alone. Even though I may feel like I'm alone, we all struggle in our lives. And right now, I'm in a moment of struggling and some suffering. Next, I would like you to put your hands over your heart. Feel the warmth of your hands and the gentle touch of your hands on your chest, or whatever soothing touch feels good to you. Some people like to put their hand under their armpit and put their other hand on their shoulder and give themselves a hug. Some people like to rock back and forth as a way to soothe them in this moment of caretaking themselves. Next, I would like you to say to yourself, may I be kind to myself? You can also ask yourself, what do I need to hear or do right now to express kindness to myself? And finally, is there a phrase that speaks to you in particular situations such as this one? Maybe the phrase is, may I give myself the compassion that I need? May I learn to accept myself as I am? May I forgive myself? May I be strong? And may I be patient with myself? So that, Beth, is an example of one of Kristen Neff's self-compassion exercises that takes us beyond that surface level self-care into more of that internal resourcing. When the caregiver doesn't have the option to go get their nails done, they don't have the option to bring in respite care today. They are in this caregiving role, but they still need to be able to resource and give themselves that moment, as we just did here.
Thank you for sharing that. Those tools, just the introduction of them in therapy, I think could be so powerful because they acknowledge that caregivers can become irritable, that we can become resentful, that we can feel hopeless, that we can experience back pain and neck pain and all of these other things that may be directly or indirectly related to just that role. And I think just that acknowledgement is really powerful. I know I had the experience at some point in time where we walked into the oncologist's office and the doctor said, how are you all doing? And I fine. We got the test, we blah, 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 whatever. Let's talk about the results. And the oncologist stopped and she said, and how are you doing? And it was like the world just stopped spinning. And I totally started crying because in the midst of all of this, no one had really asked me. It was like we had so many things that were in front of us that we hadn't anticipated. I have said before, contemplating the mortality of your child puts you in a different camp of lived experience and how you were approaching the world in that moment and probably how you approach the world forevermore. And it was the first time that I felt like someone who had seen some of this stuff unfold, just stopped and said, what is that like for you? And it was just because it was the first time I think that I even acknowledged my heart is breaking. It feels like everything that I have grown to anticipate has just disintegrated around me. And that changed me. And I think that's true for so many caregivers. Thinking of other examples of caregiving that I've seen, just not even clinically, but personally. And the power of just somebody acknowledging it's okay for this to be awful. And that doesn't make you ungrateful. That doesn't make you a bad person. It's okay for you to just want to scream and tear your hair out or to just be, a mess and be devastated. I think just that acknowledgement is powerful. So thank you for introducing these resources. I know we'll have more conversation about resources. For me personally, I think one of the most powerful things has been being in caregiver groups, just because that disconnect can sometimes be so visceral where it's like, I've totally walked into parenting circles and everyone's talking about who didn't get the school play lead role. And then I am, there's a storm cloud over my head in that moment. And I'm like, God, I wish I had that problem.
Right. You're on level 10
right.
of a problem, not level 2.
Right. It's that's a problem. That is totally a problem. And there's many kids right now who are very upset. That is a problem. And I really wish I could actually trade out the problem that's on my heart right now for that one. And that's a really isolating feeling. And I think being in groups has been a place for me, all I can liken it as is kind of welcome to ugliness, where it's kind of the dark side or the shadow side of caregiving. While there are so many beautiful things associated with caregiving and so much research that's pointed to a lot of people find a lot of role and identity and meaning in it simultaneously, it can be so painful.
Absolutely. And you hit on so many valuable things, Beth. And I think one of the most important things, whether you are listening to this podcast as a clinician and or somebody that also has, like Beth and I, has, some lived or personal connection or experience is, first of all, I just want to acknowledge that provider, that physician, A plus for that oncologist for pausing and directing attention towards you, because especially I think in our medical field, we don't often find that that's the case. Usually the physician is focused on the patient, and they're courteous and they're friendly and respectful to the parents and family members, but we don't often have a physician that really does stop and put the spotlight on you as the caregiver. And as you said, when a caregiver's asked that, they often have not been asked that. And so for them, as you said, it's just this like, what, who, me? Me? Oh, I'm supposed to talk about me, because as a parent, when your child is ill, when your child, if there's a precarious situation with your child, we basically void ourselves, right? And speaking as a mother, Beth, we void ourselves of everything, every energy devoted towards us. And it all really goes into that child that is sick, that has a need, that you're in the office waiting for the test results. And so to be asked about how we are doing, it's like, what do you mean me? I don't have a me right now. My me is in my child. But what that oncologist did is something that all of us can do, whether you are a clinician, whether you are a family member, asking that caregiver, how are you? And not, oh, how are you? But it's a sincere, like, I really care how you are. Let's have a conversation. How are you? Kind of question. And you also mentioned the reality of all of these, as you said, the dark side of caregiving, which is completely separate from the love and the devotion and the dedication that the caregiver has. There's the human side of their everyday experience and lots of different emotional experiences, as you said, irritability, anger, sadness. Caregivers often feel, as we talked about earlier, that they're behind this glass and they're watching the rest of the world. As you said with the sledding analogy, it's like you are behind this glass and you're watching the rest of the neighborhood with their coffee and their sleds and the snow. It's a snow day and everything's great and the kids are sledding and it's wonderful. And caregivers are often behind this glass. And the pain of that is they're able to watch what's happening. They have full awareness of what's happening in the world outside of their own world, and they're knocking on the glass like, "Hey, what about me? How do?" But the glass is this barrier. And when somebody asks, "How are you? How are you doing? What are you experiencing?" And when they validate the dark side of caregiving, when a caregiver can share, "I'm really feel some resentment that I have to take care of this person," and when somebody else can say, "It's okay to feel that. It doesn't change your dedication, your love, your commitment. I honor and I value and I'm validating that it's very natural to feel resentment, to feel like you can't take another minute of this." Quick analogy, Beth, I just want to share with you that just came to my mind regarding that I just want to kind of share my own experience with resentment. I have 4 dogs and 4 dachshunds, as you can see from my photo here in my background. And my oldest dog, her name is Mavis. She is almost 14 years old. She is, she's an elderly dog. She's coming to the end of her life, still very spry and active, but she does have an enlarged heart. She has a heart rhythm. And so she is now on, for the rest of her life, a medication that helps manage all of that and keep it pretty manageable. But one of the side effects of the medication is she gets incredibly thirsty. So she drinks a lot of water and she has to go to the bathroom really often. And that means also in the middle of the night. So, it's kind of like 1 o'clock in the morning and she sleeps on our bed. 1 o'clock in the morning, 4:30 in the morning, you can feel her stirring. And, we have to get up. She goes and drinks a lot of water and we go outside. And sometimes she'll be outside for 10 minutes. She likes to kind of walk around in the yard. And I'm not going to lie when I say there are moments where I feel her stirring, and my first feeling is resentment towards my precious, wonderful, unconditionally loving dog. Is when I realize that we have to get up again, it's like, okay, and it's this, you can feel that rising within you. And I have to really just do my own kind of resourcing, like we talked about earlier, and really connect with that empathy and that compassion for her as a living creature, for her having this basic biological need of I'm thirsty and I need to pee, and dialing back that resentment, but it's there and I feel it. And so I share that experience because it's important for us to validate with people that are caregivers, and to, if we can connect in any way in our own lives of what it means to need to give care to someone, especially when it's the middle of the night and we're tired and our sleep's been interrupted and we love this creature more than life itself. But the human side of us at 3 o'clock in the morning says it's 3 o'clock in the morning and I don't want to get up again. That's where that dark side of caregiving kind of creeps in. So it's real. And the best thing we can do as providers and as family members and loved ones is let people talk about that dark side. Let them scream, let them pour it out. Ask them to share it with you and just hold space as they share it and validate that.
Thank you for sharing that example. And I think it really illustrates that point. In talking with other caregivers, for some of us, this is going to be with some ability to anticipate lifelong. This is not an illness that may resolve. And that is, for many people, a major source of grief. We tend to be relatively future oriented. Go to a job interview and you're going to be asked, where do you see yourself in 5 years? And we do this, we live in this kind of fantasy. And to see all of that change, I have listened to someone talk about how they had this vision of what retirement was going to look like for them. And, that they are empty nesters, quote unquote. What would it be like to travel? And they'll get to do all these things. And this person's realization that those things are probably never going to happen the way that they had envisioned, because there are no other people or facilities that are able to care for this family member in this way. And that's a big dream for that person to let go of. And I don't know if we ever do. But I think simply the establishment that, we can't CBT our way out of this one. Sometimes what we're witnessing or what we've lost, it doesn't get resolved. It's ongoing, and it's this grief. And I think the power of someone sitting with us in that cannot be overstated, to just have a safe space, because it's a lot of pressure on many caregivers to keep track of all of the tests and make sure that those prescriptions are refilled. And don't forget signing up for occupational therapy. You have to do it on this day or it's going to be pushed back a month, or, whatever it is. It's so much up here. But so a space where someone can forget that for just a minute and feel whatever it is they want to feel, I think is so powerful.
Absolutely. And I think we need to recognize the value of that. And I'm so glad that you mentioned grief and loss, because, our understanding of grief and loss now, as opposed to decades ago, is that it encompasses much more than somebody physically dying and passing away, that there is grief and loss that extends, as you're saying, into life being different, into this anticipatory grieving that people may experience as they find themselves morphing into this role of being a caregiver versus being this traveling kind of free empty nester, or a parent, as you talked about earlier, that when that child turns 18, there's not, for a lot of parents, there's not going to be, they're going to college or they're moving out, or they're going to be spreading their wings, and now they're this autonomous, independent young adult. That's not going to be the case for every caregiver who is a parent. And so I think that we do need to, whether we are a friend, family member, or provider, we do need to often, one of the best things we can do with somebody is just to be with them. Sometimes we feel as that supportive person that we need to have a magical thing to say, or we need to be able to offer, like, have you talked to a counselor? Have you gone to a group? And yes, those are all great options, but I don't know, Beth, do you feel like sometimes what is really helpful for you as a caregiver is just to have somebody come and sit with you and have a cup of tea, maybe sit out on the porch or laugh about something, or be in the same space with you and maybe allow you to be open with what you want to do? Or what do you feel is valuable for you as a caregiver in dealing with all of the different aspects of that? What have you found most helpful from other people?
Presence.
Presence.
And
Yeah.
so I think that's where clinicians maybe walk a fine line, because we want to provide resources, and I think that's important. And it's also so important, I think, just to have a space to be messy. I think one of my most powerful experiences looking back on it was a day that I called a really dear friend, and I was so upset that I was like squeaking. Like words were not coming out. It was just like breathing and squeaking. And all she said on the other end of the phone was, "I'm here." It was so powerful to not be alone. And I think maybe that's one of the most powerful things that clinicians can offer to clients, is to not be alone.
Yes. And in that lovely moment, Beth, that is now etched in your mind forever, there was the presence of your friend, and then there was also those two words, I'm here. And as we were just talking about, sometimes we think that we need to have these long soliloquies that we can offer the caregiver, but and on the phone, that feeling the presence of your friend on the phone and her saying I'm here, and that being able to be felt by you across a phone, can be so very powerful. And so I think that really, I think if anybody takes anything out of our podcast, maybe it's this, maybe it is this art of companioning. And I love this word when we talk about grief and loss, and and how life may not be what we imagined or hoped it would be, this concept of companioning. And companioning does not seek to assess or analyze or fix or resolve. It's about being totally present with the caregiver. And I also like this phrase, being a temporary guardian of their soul. So you are being a temporary coming in and holding them, their soul within you. And to me, it feels like that's what your friend did by saying, I'm here. I am here right in this moment to help guard and protect and hold space with you and your soul and everything that is within your soul and your heart in this moment.
Yes. That perfectly describes it. And having not heard the term companioning, thank you for sharing, because I think it does so beautifully encompass that concept. Because many of us who are clinicians, we're in the business of trying to help people feel better faster. And sometimes we can't. Sometimes the situation in life is such that it's just bad. And it would be minimizing for somebody to be like, but what are the silver linings of that? Like,
Exactly.
well, those are dark silver linings.
Yes.
One fewer mouth to feed, like, well,
Right.
like this gets dark very fast, which is actually another point I'd love to bring up. I've also found that that's one of the things that I connect to most strongly. And I think a lot of people who are in caregiver roles is humor, because it's so dark. Like, it's sometimes so dark. There is so much trauma that occurs at caregivers. I mean, the stories about holding a loved one down for additional tests, the stories about needing to clean up bodily fluids for the person that raised you, what's it like to be terrified as you're trying to support somebody who's having a seizure, and you do this regularly, or if their blood sugar goes weird during the night, what if the alarm doesn't go off? Like, these are very trauma-inducing realities, and the space to acknowledge that, I think, is critical. As you said, like, just that companioning and the phenomenon of I'm here, but recognizing too that sometimes our best tool for dealing with the things that are really difficult may also be humor. And it may be that dark humor. And I just did it. I'm very guilty of dark humor in order to cope with the gravity of what we're discussing.
And what's interesting, Beth, is that humor is not unique when we look at coping with life's difficulties and trauma. Even we look that humor, and it's interesting. You would think, well, how does humor fit into something as dark as bodily fluids and caregiving and all of these, really kind of difficult things? But it does something for the soul, for the spirit, if it's at the right moment, if it's the right kind of humor. Physiologically, the laughing actually can change our cells in a good way. And so really, I think that we need to find these options to be able to have these, as I mentioned earlier, these moments of resourcing, whether it is self compassion or whether it is, reaching out to a friend, even if you can't speak. You can't physically speak, but the friend can say, I'm here. Or it is being able to use humor and laugh for a few minutes at something that in the moment was completely, you didn't think you'd be able to get through with it. But now on the other side of it, you're like, okay, now is the point at which we can laugh about it because I'm out of the particular situation. I also want to, just kind of pick up on what you mentioned earlier about the importance of not silver lining people's experiences. And if anybody wants a really great video to check out on YouTube, watch Brene Brown's video on empathy. And when you mention silver lining, it reminds me of her video, which I think very beautifully gives us this animated example of how sometimes our efforts to be compassionate and empathetic actually land by silver lining versus what we talked about, which is that companioning, going into that person's world and sitting in with them and being with them and companioning with them. And sometimes that means not saying anything other than I'm here.
Thank you for bringing that up, and I love that video. But yeah, that's a really powerful concept, is just simply being with somebody in grief without trying to fix it. And that is another element, I think, of the caregiver experience. Just like any kind of grief can be people trying to help, but in doing so, saying something that makes it worse, and maybe not makes the lived reality worse, but I think what it can accomplish is a lack of connection with that person. And so then the caregiver goes, I can't talk to you about this.
Yes. So that relatability, and a caregiver feeling like, as you said, this is a safe, open, understanding person that's able to really get down on my level, even though they have not had that lived experience themselves, they are able to sit with me and to be with me and to really provide empathy, which, as we know, empathy means, you don't have to have gone through the experience somebody has, but everything we've talked about with that companioning and being able to join in with someone and imagine the emotions that they are feeling and experiencing and how you have felt those emotions in your life at some point, even if it's a completely different experience than what they're going through. But when have you felt sad? When have you felt resentful? When have you felt like a responsibility will never end and you can't come up for air? So yeah, I think that we come to know pretty quickly, like, who are the people that are like your friend that were on the phone and who are the people that are trying to be supportive, but really are not able to offer you what you really need.
This conversation, Diane, I know for me has been powerful in more ways than one. You've introduced me and our listeners to resources that I don't think many of us knew about, and I really appreciate that. And I think you've presented it with so much compassion, which I think is the foundation of the work we do, particularly when it comes to grief like this. There is so much more to be said, but can you share, in addition to those kind of assessment tools that you've already provided, what are some of the lower hanging fruit resources that you feel like you can rely on as a clinician, but also that you want to give to clients?
Absolutely, yes. There is a wonderful tool that I would like to recommend that everyone check out. It is called the Caregiver Respite Tool. And the Caregiver Respite Tool is available from the VA Caregiver Support Program. And I just want to kind of mention some of the aspects. It's actually about an 8-page document. So this is a document that either a caregiver can complete themselves or they can do it in conjunction with a professional, for example. But the first part of the Caregiver Respite Tool is looking at who you are as a caregiver. Because as we talked about earlier, Beth, identity, sometimes caregivers just identify themselves as a caregiver. So the first part of this tool helps caregivers identify, who am I outside of caregiving? What brings me joy? What matters to me most? Who do I want to be healthy and strong for? And maybe that's myself or other people. There's lots of great aspects in part one here. It talks about physical health. And then part two talks about and asks questions such as, what do I notice about myself when things get hard? How do I respond, and what tools do I use when things are hard? And what is one thing I can do to make sure that I take a break every day? So there's lots of different prompting questions in this caregiver respite tool that people may find very helpful. And then the last thing I want to recommend is just a few really helpful websites that clinicians and caregivers can find some really great information on. The first one is the National Alliance for Caregiving, and that is caregiving.org. Caregiving.org. We also have the American Caregiver Association, which is americancaregiverassociation.org. And there are also some virtual support groups for caregivers. We have the Family Caregiver Alliance, and that is also caregiver.org. And then Elder Source, which is myeldersource.org. So there are some really great resources, websites especially, where you can find articles and virtual support groups in your local community as well.
Fantastic. Thank you so much, Diane. For people who are listening who want to learn more about you and about your work, what's the best way to do that?
Sure. So my website is dianebiglertraining.com, and you can reach out to me there. And I would love to connect with any of you and talk more about this topic. If you're looking for more resources around caregiving, I would love to share those with you. So please do check out my website, and I would love to connect with anyone.
Fantastic. Again, for our listeners, this is Diane Bigler, licensed clinical social worker, on an intimate and beautiful conversation about caregiving. Thank you so much for joining us, Diane. I really appreciate it.
Thank you, Beth. It's been my pleasure.
You've just finished listening to another exclusive Continuing Ed podcast by Clearly Clinical. If you like what you just heard and you need Continuing Ed credits, please visit us at clearlyclinical.com to check out our one-year membership, where you'll have access to our growing library of Continuing Ed podcast courses. Clearly Clinical, where our goal is to help you learn, grow, and shine.